Hello there. Happy holidays, Mr. Grinch. How are you today? I understand. What are we going to be seeing you for? Oh, heart palpitations. Your eyes, I can see, are yellow. Your teeth hurt. Very itchy. Okay. Anything else? Breathing is quite restricted. Okay. Well, I'll definitely be able to help you with that, okay? I know this isn't your favorite time of year, but hopefully I'll be able to help you out just a little bit. Okay. Why don't I go ahead and get you checked in, okay? Alright. First, I already know your name, but is this still your address? Okay, no problem. You've been there for, 53 years? That's a long time. You must like your location. Yes, you can definitely see everything from up there. Okay. Birth date, good. Now it looks like we saw you last year for these same symptoms. It's just okay. Yes, I see. No problem. Okay. And are you on any medication at all, Mr. Grinch? Alright. And okay, let me hold 1 second. Let me write those all down. Hold on. Okay. Let's see. And okay. We don't seem to carry that last one. Gotcha. Okay. Alright. I think that should count for all of the questions that I have, okay? So why don't we go ahead and get started with your exam. Okay, so first thing I need to do is take your measurements if you don't mind. Thank you. No, this shouldn't take long. Just please sit still, okay? Thank you. Alright. And how were your heart problems last year? About the same. How long have you been living with this? As soon as you moved to Mount Crumpet, I see. Okay. Have you ever thought about change of location? Oh, I'm sorry. Of course. I understand. We all get attached to a certain place. Good. Okay, if you could just keep your neck or your head tilted up just a little bit, please. Thank you. Just going to. Good. Okay, thank you. And then I need to do across your shoulders. Okay. Oh, your head is itchy. Okay. No problem. Well, why don't we go ahead and I can start with taking your vitals and then we'll move to that scalp check, okay? Okay. So measurements. They look about the same as last year. Okay. Perfect. Okay. So please just sit up straight and just breathe normally as best as you can. Alright, gonna listen to your heart. I can't seem to find. I hear very, very faint beating. Might be bad circulation. Oh, I see. 2 sizes too small. Oh, I'm sorry about that. Okay. Well, I'll do my best, okay, to see. Alright, and I'm just gonna listen on the back here, okay? Good. Alright, yeah, I cannot hear on your back, okay. So now I'm just going to listen to your breathing. So take in a deep breath. If you could take longer, deeper breaths, please. Oh, those are your... Oh, okay, no problem. Okay. I would definitely say you have some anxiety. Yes. Okay. Good. Good. Okay. And we'll just listen on the other side. Start on the back. Good. And on that side. Very good. Okay. And lastly. Good. Okay. Well, we might need to look into your heart being too small, okay? That could definitely cause for some other health problems that could be adding to your anxiety. Okay. So we're gonna go ahead and I'm going to move on to your scalp check. Okay. Do you have any questions for me? Right, your teeth have been hurting. Okay. And what is your diet like? Oh, typically garbage and onions. Okay, so that might be a cause for some alarm there, alright? So, we'll go over that in just a moment, okay? First I need to go ahead and check your scalp and just the rest of your fur, okay? Oh, yes, I immediately see, it looks like bits of gravel, pine needles, looks like just regular dirt. How often do you bathe yourself? Okay. We usually recommend at least a couple times a week. So you might want to up that just a bit. I understand. So it's just for overall health that you might want to consider doing that more often, okay? And I definitely do see some lice here. I'm just gonna go ahead and pick those out for you. Okay, I've got my little tweezers. They won't hurt a bit, okay? And just by the looks of it, I might want to go ahead and trim some of your hair just around. Okay. Alright, so. Okay. I see. No problem. Okay, so those are most of the ones that I can see. I'm going to send you home with some specific soap that I'm going to need you to use, okay? You'll need to use it a few times within the week. Yes, with water, okay? Okay. So let's go ahead and move on. I'd like to go ahead and look in your mouth real quick because you were saying how painful that was, okay? So if you could open up, please. Okay, yeah, I'm just gonna stay a little bit farther back, alright? This just gives me a better view. No problem, I'm just gonna just look as best as I can. Doing great. Yep, I definitely see quite a bit of tooth decay. So, what did you say your diet was like again? Onion and garbage. Oh, you have an onion with you. Oh, okay. Okay, so just like this. Okay, usually it kind of varies on the kind of onion that you eat. I understand. So we usually like to limit eating onions. They don't have a ton of nutritional value, although they do taste quite good when cooked. You said you eat these raw. Okay, so you might want to start trying to cook them. Oh, okay, so you haven't used your stove, so I first recommend trying to fix your stove, okay? And then just start learning to cook and use different ingredients. Alright, well, it can be a recommendation. Alright, so let's move on, okay? And I will send you home with that soap for your hair, alright? But for some instant relief, I'll go ahead and just spray a nice, pleasant smelling aromatic that will also help with your itchiness, okay? Alright, so if you could please just go ahead and close your eyes. Thank you. Good. Alright, so I'm just gonna keep your eyes closed. Yes, just a moment more. I'm going to let this settle. Okay, you can open your eyes. Thank you so much. And I'm going to start by looking in them. Just look right past me, okay? Yes, they are quite yellow. are definitely, let me get my glove back on, so I will need to be a little more in depth. Okay, so please still look past me. I'm going to hold down these two eyelids here. Is there any pain when I do that? Okay, well, just bear through it for me. Alright, almost there. Just holding these lids up. Okay, if you could look to one side. Good, and to the other side, please. Good. Okay, so I'm gonna need you to follow my finger real quick, please. Okay. Yeah, no, I'm just a little allergic to, winter allergies. It's nothing to do with you, I promise. So just follow the tip of my finger here, okay? We're just going to check the latency of your eyes. Okay. I want to make sure that this yellowing isn't causing any other problem. Okay. How long have you had it for? Oh, I see. Okay. Well, maybe there's something we can do to help it out. Okay. And when was the last time you had a nice Christmas or just festive holiday? Never. Alright. Well, that could also help with your anxiety too, okay? I know that the Who's down at Whoville would absolutely love to have you. I hear it from them every single year. I know. They can definitely be quite energetic. Yes, I know. So many people want to be just hanging out, watching movies, and just being alone away from people. I understand. But it's nice to get out every once in a while. Okay, there we go. Thank you. Alright, so I'm going to go ahead, if you don't mind. I'm going to put these special drops in your eyes, okay? And these will help reduce the yellowing and have a nice, gentle, relaxing kind of feel to them, okay? So I'll go ahead and just get a couple. So if you could tilt your head back and just keep your eyes looking up. Thank you. Okay. So just drop, drop, drop. Okay, I'm gonna move to the other one. Drop, drop, drop. Okay, perfect. Now if you could just slowly blink. Good. Just keep slowly blinking. Good. Being quite patient. Your dog teaches you patience. I understand. Yes. How is he doing, by the way? Oh, good. I'm glad to hear. Alright, so now if you could close your eyes. Good. I'm just going to massage that oil or drops in your eye, okay? Good. Perfect. Okay, and then I'll just massage your temples there. Alright, so you can open your eyes back up, alright? And I am just going to look closer at your skin, okay? Just going to get a little bit closer, alright? Good. Okay. Alright, not surprisingly, your skin is very clear. Okay, so there's nothing we need to do for that. I'm going to look in your ears real quick. Okay. Just gently. Oh, it looks like we have, not sure what. It's just excess. Okay. Okay. Well, I will give you some. I don't know what I'll give you. I would need this. Well, why don't we just go ahead and leave that the way it is, okay? You said it doesn't bother you. It's always been like that. Alright, well, why don't we just leave that and I'll just make sure that there's no any swelling or anything that could worsen. Okay, why don't we just go ahead and leave your ears the way they are, okay? And I want to also just check your nose, so if you could just please lift your chin. Thank you. I'm just gonna look right. Okay. So, okay. Let's move on. Okay, I'm going to just take some notes here. The itchiness has gone down. Oh, good. Okay. Alright, so I'm going to take these notes. And did the nurse tell you your height and weight? Don't know, don't care. Okay. Alright. Okay, so that's good for that. Alright. So next, we're going to work on your facial expressions to see if there's any muscle dystrophy or anything. So if you could go ahead and raise your eyebrows. Now just raise your eyebrows. Oh, you are. Okay. Hold on one moment. Let me see. Can you feel that? You can. Okay. Feel that. And that. That. Alright, so go ahead and relax them. Are they usually naturally lower than usual? Okay, alright, so just relax right there. Could you open your eyes wider for me? Oh, good. Okay, perfect. And now gently close them. Good, and you can keep them open. Alright, can you smile for me? I can see you trying. Doing good. Okay, let's go ahead and test that. Alright, can you feel that. Okay, that. Okay, and that. Okay, and so then just relax. Good, okay. That looks totally fine. You said that's been your way your entire life. Okay, alright, so if you could please shrug your shoulders. That's a very nice shrug. Okay, good, okay. Let me just feel. Okay. Good. Alright, if you could go ahead and just hold your arms out. Okay, and go ahead and place them down. Thank you. Alright, and if I could go ahead and see your hand. Thank you. Okay, so it looks like the little tufts at the end of your fingers are looking good. They look like they're growing in fine. Okay, good. And let me see the other one. Okay, and this one looks just as good. Okay. Alright, sounds good. Well, needless to say, I think you are actually in okay health. There might be some things that you want to improve on. Just, out of overall common sense, health and hygiene. But besides that, maybe work off some of those medications if you can, and start trying to enjoy and embrace the holiday spirit. Yep, no, don't mean to offend. So if you really don't want to, then by all means, you can continue your life however you like, okay? These are just some recommendations, okay? Yes, I'm sorry about that. Okay, well, why don't I go ahead and let you on your way? The holidays are just around the corner, so I don't want to hold you up from whatever you're planning. Alright. Okay, well, you have a pleasant holiday. Thank you. Oh. Okay. I'll see you next year. Bye-bye.